Hello, everyone. Welcome to another review class from Lab. This time we talk about slow pulses, the Shimai. We shall be starting the series of slow pulses. So there are actually four slow pulses. We have the slow pulse, the one that we will discuss today. Then we have moderate pulse, choppy, and knotted. They are all slow. Let's start with slow pulse. The slow pulse is less than 4 beats per respiration, which indicates cold patterns. No? A slow and powerful pulse is caused by chi stagnation due to congealing cold. Alternatively, a slow and powerless pulse, so that means it's a weak pulse, slow and weak, it is yang deficiency, the chi and blood moving slowly. What is defined as a slow pulse will be different from person to person. So a rule of thumb is that a pulse lower than 64 beats per minute is a slow pulse. So check your pulse now. No? The slow pulse arises, of course, when there is cold. Deficient cold can be seen when there is yang deficiency, in which case the pulse is weak and slow. Excess cold blocks yang and inhibits blood in its movement by contracting the vessels together. When there is excess cold, the pulse will feel tight or confined. The depth of the pulse will give an indication of which aspect of the body the cold is located in. So the typical combinations, if it is slow and weak, that's yang deficiency. Slow and full, tight or confined, that's excess cold. Slow and superficial, remember superficial, that's invasion of cold or exogenous, invasion of exogenous cold. Slow and deep, because it's deep, so it's internal cold. Slow and slippery, so that's damp cold, okay? The pulse beats less than 3 times per practitioner's breath, about 40 to 60. But earlier we have decided it's as long as it's below 64, it is considered a slow pulse, but with a regular rhythm. The pulse frequency is less than 3 beats per breath. No? So the indications. So we have two types. Okay. So if it is slow and forceful, there's cold accumulation. If it is slow and forceless, that's deficiency cold. It can also mean chi deficiency. So the biomedicine counterpart would be intracranial hypertension. Wow. Obstructive jaundice, RHD, or rheumatic heart disease, viral myocarditis, kasi slow ha. So you need to be very careful when you have patients whose pulses are slow. So you need to really refer, no? Kasi who knows, it may be either or any of this one, okay? So could be viral myocarditis, or there might be coronary heart disease and digitalis poisoning, okay? Okay, pathogenesis, or how the cold syndrome has evolved. Cold causes contraction. So when cold invades the body, or a deficiency of yang produces cold, of course, you will observe qi and blood to stagnate, no? So the qi and blood circulation in the vessel slows down, as does the rate of the pulse. So if it is due to qi deficiency, okay, so remember, qi deficiency can also give you a slow pulse. Qi commands the blood, and when qi is deficient, the pulse will also move slowly. However, the slow pulse is seen in some healthy persons, specifically athletes or those who engage in daily physical labor. Okay. A pulse which beats only 3 times per respiration is called a slow pulse. It usually results when yang qi is too weak to defeat the yin cold perverse qi, or when deficiency of qi and blood will cause a deficient cold condition. Slow pulse, which is floating, So that means there is superficial, perverse cold chi, no? Wind invasion, cold wind invasion. Slow pulse, which is sinking, that's perverse cold chi. Okay? To treat these types of deficient yang, excessive yin diseases, you need to strengthen the yang chi. A, a slow pulse, which is slightly faster, is called a leisurely pulse. So leisurely pulse is slightly faster than a slow pulse. A slow pulse, which is thin and minute, lacking strength, yet rough and uneven, is called choppy. So the key word here is rough and weak and slow, thin and minute. Slow pulse, which is floating, big and soft, is called an empty pulse. According to tradition, floating, big, soft, slow pulses are symptoms of deficiency. The slow pulse usually appears in diseases involving the Zhang Fu Qi. For instance, in spleen yang deficiency causing excessive damp phlegm, there can be a slow pulse. Okay, because we all know that phlegm can actually impair blood flow, diba? And chi flow. The slow pulse, which is strong, usually indicates internal accumulation of excessive pain-inducing cold. So that means your patient must be in pain kasi lamig na lamig siya, no? The pulse, which is slow but lacking strength, indicates deficiency of yang qi, causing deficient cold or empty cold. Now let's go to the pulse positions. Um, if you recall, I think everyone is familiar with this, the Tsun position reflects conditions of the upper heater. Therefore, when perverse cold accumulates at the heart and chest areas, you can feel the slow pulse at both Tsun positions. Sige, feel nyo yung pulse nyo sa Tsun position. Okay? So that means if it's slow, perverse cold is accumulated at the heart and chest. Now, the Guan position reflects the conditions of the middle heater. Therefore, when accumulated cold damages the spleen and causes painful spasms in the tendons, you can feel the slow pulse at both right and left Guan. No? Then we have the shear position, reflects conditions of the lower heater. Therefore, when deficiency and failure of kidney fire cause heaviness and pain in the loins and thighs, or incontinence of urine or scrotal hernia, the slow pulse can be felt at both shear positions. So be very mindful of this. So this can actually help you, this can actually guide you in the diagnosis. Okay, so it has been a tradition ever since we started doing this special class. We always end the lecture with an assessment. Who would like to volunteer? Um, Sir Jobel? Ay, okay, nakatakip na naman. Okay na, Ma'am Trix, ikaw na lang.
Okay.
Wala rin si, ano, okay, anyway. Okay, we only have 10 questions, and I'm very happy we're ending very early. Next. Okay, number one. When you have a superficial or floating pulse, what does this generally mean? So you felt the pulse of the patient, ay nako, floating na floating talaga. So that means you don't feel anything when you press harder, no? So you should differentiate this from the overwhelming pulse or bounding pulse. So when you have a superficial or floating pulse, you don't, when you press deeper, middle and lower, wala. Okay. What does this generally mean?
Exterior pattern.
Okay. So you have an exterior pattern, or this is an external problem. Okay. Next. Um, It's still superficial or floating pulse, pero excess. Oh, yan palang excess that's already a given, no? So what does this mean? Kanina, you still don't know if it's excess or deficient, no? But this time you already know it's excess type of a superficial or floating pulse. So what is this?
If it's a floating tight, it's wind cold. If it's floating rapid, it's wind heat.
Ay, wow, talagang inano na niya. Okay, actually, there is an invasion. Yeah, you're correct. You have an EPI invasion, external pernicious influence. Um, we don't call it anymore as pathogenic chi, according to the new books, no? External pernicious influence. Pero parang mas mahirap siya,
Or EPF.
o EPF na lang, external pathogen. So you're
Pareho.
correct. So every time you have an excess pattern, that means there is actually pag meron talagang pathogenic, external pathogenic factor, that's excess, no? Number three. Okay, kanina excess. Now we go to deficient. Okay, you felt superficial or floating siya, and then the pulse is weak. It's deficient. What does it mean?
If it's floating empty, it's a yin deficiency. If it's floating weak, it's a prolonged illness.
Okay, general deficiency
Deficiency
or a floating yang. So that means um
or floating.
the yin is deficient. Floating lang siya, kaya napabayaan si yang, no? Okay, now we go to, okay, it's no longer superficial or floating pulse, but this time we have a deep or sinking pulse. Okay, what does it generally mean?
Can be felt with heavy pressure near the bone, and it means anterior syndrome.
Hindi naman necessarily near the bone. Talagang kinasify. You do not feel any pulse of superficial and middle, pero deep ka agad, no? So usually you have to probe really deeper. Okay, sometimes, yeah, correct. Sometimes you would feel it near the
Sometimes
bone
it's at
already.
the
So
bone.
kanina we said, pag superficial or floating, it's an external problem. So this time, pag ganun mo, ay, malalim siya. Malalim siya. So what is it?
Interior syndrome.
Interior syndrome or internal problem? Automatic na kaagad. I'm sure you know the next one. Excess naman. Okay, you felt na, deep siya, pero excess, ang tapang, no? So, what could be the reason here?
Interior excess or heat and cold, chi or blood stagnation.
Very good. Wow, galing. So usually the patient is in pain here. Do you agree that when you have internal cold, the in pain din yung pasyente, di ba? So chi or kasi di ba, you don't expect the chi to be moving at all.
Yes.
Chi or blood stagnation. Okay? So the next one problem deficient naman. Okay. Okay, deep sinking pulse and it's deficient. What comes into your mind right away?
Interior deficiency or chi deficiency or yang
Chi
deficiency.
or blood deficiency. Yeah, pwede
Oh,
ding yang, but I think I would be more inclined to use pag yang
chi.
yeah, pwede rin. Oh, pero most so you have to look at the tongue, no? Uh, compare mo kaagad sa tongue, no? Like pag yang deficiency kasi the tongue would be slightly wet, no? And chi deficiency you don't actually see anything at all.
Mm-mm.
No? While blood deficiency the tongue may be thin and kulang nga sa blood so might be slightly dry, no? Um, okay, what does a fast or rapid pulse generally mean?
It means it's 5 beats per breath or 90 to 120 BPM.
Actually, hindi
And
mo
then it's
kailangan bilangin eh. Ang bilis naman. Alam mo na
it's a
kaagad.
heat
A
pattern.
hit, yes. Actually, there's a big difference talaga, no? You could immediately tell now. Actually, you can compare it with your pulses. So it's like, it's really fast. So, heat na siya. Okay. Fast or rapid pulse, tapos excess.
Full heat.
Yeah, what do you expect to see on the tongue with
It's
regards to
red.
coating?
It's red.
What about the coating?
Full heat. And then, no coating.
No. Uy,
Dry.
hindi,
Sorry.
hindi. No, 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 no.
Yin.
Fully.
Wait.
No.
Ano, yellow. Thick
So the
yellow.
coating is thick.
Thick yellow,
Yeah.
sorry. Thick yellow.
Remember, this is full heat.
Di
The
ba pala
coating
siya?
is yellow. Yeah.
Di pala siya empty.
So, di ba, like sabay-sabay mo kaagad. So, it's mabilis, then it's excess, full heat. Without, you would immediately think, siguro the coating is thick and yellow, no? Or, of course, it should be dry because it's
Yes.
full heat, right?
Yes.
So, you don't
Yes.
actually look at the ano kaagad eh. Di ba, Sir Joe Bell?
Mm.
Ay, nagpakita lang. Okay.
Yes, Doc. May pasyente po.
Okay. Sige, tinan mo kaagad yung tongue. Putulin mo yung tongue. Okay. Let's go now to rapid or fast pulse. Tapos, deficient. What is in your mind right away?
Yin deficiency heat or
Yes,
fever
true.
or disease.
Deficient eh. So,
Myocarditis.
full heat. Tingnan mo ha. Full heat and empty heat. Okay, alam naman natin empty heat is due to yin deficiency, right? Okay,
Yes.
so will both give you a rapid pulse. The only difference is that pag, pag,
Tongue.
pag wait lang. Empty or yin deficiency, what do you see on the tongue? Sir
No
Joe?
coating.
No.
Sorry.
And of course, the red, kasi you can also find a red tongue, no? Both full heat.
Yeah.
The only difference is the presence of the coating. Yeah.
Coating.
Malapit ka na doon magmali, ha? Actually, nagmali. Okay, let's go now to slow pulse. Okay, what does it generally mean when you have slow pulse? Kanina lang.
A cold,
Yeah.
cold yang deficiency.
Okay. Wow, congratulations. Thank you, everyone. I really had fun. I hope you also did. And
Thanks, Doc.
thank you so much.